Have you ever stopped to think about what happens when older men stop masturbating? It's a topic many avoid discussing, cloaked in stigma and embarrassment. But the truth is, masturbation is not just a youthful pastime or a taboo topic. It's a vital part of men's health at every age. For elderly men, the decision to stop masturbating can have significant effects on both the body and the mind. As men get older, natural changes occur. Hormone levels drop, blood flow slows, and energy declines. These shifts can lower sexual desire and function, sometimes leading men to abstain from masturbation or sexual activity altogether. While it might seem harmless or even wise to avoid sexual stimulation in old age, medical experts, especially urologists, warn that this can lead to physical and psychological issues. In this video, we're diving deep into why masturbation matters for men over 60, what happens when you stop, and how urologists recommend maintaining sexual health safely and comfortably. We'll look at the science behind it, share emotional insights, and highlight real-life stories to show you why this natural act should never be dismissed, no matter your age. Part 1. The role of masturbation in male physiology. Masturbation, often misunderstood or trivialized, is actually a complex and vital physiological activity. It plays a critical role in maintaining the health of various body systems in men, especially as they age. First and foremost, masturbation promotes healthy blood flow to the penis and surrounding pelvic tissues. The erectile tissue relies on regular engorgement with blood to maintain its elasticity and function. Just like a muscle, these tissues need exercise to stay strong and responsive. Without regular stimulation, the tissues can become less elastic, which is a significant contributor to erectile dysfunction. From a hormonal perspective, masturbation triggers the release of testosterone and other important hormones. Testosterone is the key hormone for male vitality, influencing libido, muscle mass, energy levels, and overall well-being. While testosterone naturally declines with age, activities that stimulate its production, including sexual arousal and ejaculation, help slow this decline and preserve male health. Beyond hormones, masturbation stimulates the brain to release neurotransmitters like dopamine and serotonin. These feel-good chemicals regulate mood, reduce stress, and promote relaxation and sleep. In elderly men who face higher risks of depression and anxiety, the regular release of these neurotransmitters through masturbation can provide essential mental health support. The prostate gland also benefits from regular ejaculation. It produces fluids that contribute to semen, and regular release of these fluids can help prevent prostate congestion and inflammation. While scientific studies continue to explore this, many urologists agree that regular sexual activity or masturbation lowers the risk of prostate problems. In sum, masturbation acts as a natural mechanism to maintain vascular health, hormonal balance, neurological function, and prostate well-being, making it a vital part of aging healthily. Part 2. What happens when you stop masturbating in old age? Choosing to stop masturbating can lead to a range of physical, emotional, and psychological effects, particularly for men over 60. Physiologically, the absence of regular sexual stimulation reduces blood flow to the genital region. Over time, this lack of circulation causes the erectile tissues to lose elasticity and muscle tone, making erections harder to achieve or maintain. Since these tissues require periodic engorgement to stay healthy, inactivity can accelerate erectile dysfunction. The prostate gland, which benefits from regular clearing of fluid, can become congested when ejaculation is infrequent or absent. This may lead to prostatitis, a painful inflammation of the prostate, or contribute to urinary problems common in elderly men. On the hormonal front, the lack of sexual activity can result in lower testosterone release. This leads to reduced energy, decreased muscle mass, mood disturbances, and lower libido, further discouraging sexual expression. Mentally, masturbation acts as a natural stress reliever. Without this outlet, many men experience increased anxiety, irritability, and symptoms of depression. The loss of dopamine and serotonin surges also negatively affects sleep quality, potentially leading to insomnia or fragmented rest. The emotional impact is profound. Sexuality is closely linked to masculinity and self-identity. When masturbation ceases, men may feel a loss of connection to their bodies and a diminished sense of self-worth. Loneliness and feelings of isolation can deepen, especially when compounded by cultural stigma surrounding sexuality in old age. In essence, stopping masturbation creates a cascade of negative effects that extend far beyond the physical act, influencing mental health and quality of life. Part 3. Urologist recommendations and safe practices. Urologists and sexual health experts agree. Masturbation is a natural, healthy, and safe practice that should be encouraged at any age. For elderly men, maintaining some level of sexual activity or masturbation is crucial to preserve physical and emotional health. Medical professionals recommend adapting sexual activity to suit individual health conditions. Masturbation does not need to be frequent or intense. Gentle and regular stimulation is enough to promote blood flow, keep muscles toned, and sustain hormonal balance. Safety and hygiene are essential. Men should ensure hands and any objects used are clean to prevent infections. Using water-based lubricants can help avoid irritation, especially as natural lubrication decreases with age. Men with chronic diseases or on medications should consult their doctors to understand how masturbation fits into their health plan. Conditions like cardiovascular disease may require adjustments, but in most cases, masturbation remains safe and beneficial. For those experiencing pain, erectile issues, or psychological blocks such as guilt and shame, professional support is available. Sex therapists and urologists can help rebuild a positive relationship with sexuality, addressing fears and misconceptions. Overall, masturbation is part of a holistic approach to healthy aging, complementing physical activity, diet, and social connection. Part 4. Psychological and emotional impact of sexual inactivity. Sexual inactivity can significantly affect mental and emotional well-being. For many men, masturbation is a source of pleasure, relaxation, and emotional release. When masturbation stops, men may experience heightened feelings of loneliness, frustration, or sadness. The absence of orgasm-related dopamine and serotonin surges can contribute to lowered mood and increased anxiety. Concerns about aging, attractiveness, and masculinity may intensify, creating cycles of negative thinking and avoidance of intimacy. This can erode self-esteem and lead to social withdrawal. Stress levels may rise as sexual release often acts as a healthy tension reliever. Without this outlet, irritability and emotional instability become more common. Conversely, men who embrace and maintain their sexual health often report greater happiness, confidence, and resilience in later life. Open conversations and breaking taboos around sexuality in old age are key to improving emotional well-being for many men. Part 5. Real-life stories of transformation. Hearing personal stories sheds light on the true impact masturbation has on older men's lives. John, 68, stopped masturbating after prostate surgery due to pain and fear. Over time, he noticed his energy and mood declining and sleep problems worsening. With encouragement from his urologist, John gently resumed masturbation and was surprised to find improvements in his mood, energy, and sleep quality. Rajesh, a 72-year-old man raised in a culture that viewed masturbation negatively, avoided sexual activity after experiencing erectile dysfunction. This led to depression and social isolation. After counseling, he embraced masturbation as a form of healing, which improved his self-esteem, reduced his anxiety, and helped restore his physical health. Carlos, 64, with diabetes, stopped masturbating and soon felt disconnected from his body and life. Joining a men's health support group, he learned how to safely reintegrate masturbation, leading to renewed energy, improved mood, and a stronger sense of identity. These stories remind us that masturbation in old age is not just about pleasure. It's an essential part of holistic health, connecting body, mind, and spirit. Part 6. How to safely reintroduce masturbation in old age. Reintroducing masturbation after a period of inactivity, especially in older age, requires patience, self-awareness, and a gentle approach. The body changes with age, skin becomes more sensitive, muscles may weaken, and energy levels fluctuate, so it's important to adapt accordingly. Start slowly and listen carefully to your body. Use plenty of lubrication to avoid friction or discomfort. Opt for water-based lubricants as they are gentle and safe. Experiment with different techniques and pressures, finding what feels comfortable without causing irritation or pain. If you experience any discomfort such as burning, soreness, or unusual pain, pause and consult a healthcare professional. It's important not to push through pain, as this can lead to injury. Mindfulness and relaxation techniques can enhance the experience. Creating a calm, private environment helps reduce anxiety and increases pleasure. Breathing exercises or meditation before and during masturbation can ease tension and promote relaxation. Communicate openly with your partner if you have one. Discussing your needs and concerns can strengthen intimacy and reduce feelings of embarrassment or isolation. Incorporating regular masturbation into your routine, even a few times a week, supports blood flow, hormonal balance, and emotional well-being. Remember, consistency is more important than frequency. Regular engagement with your body helps maintain function and connection. Finally, consult your doctor or urologist if you have any concerns, particularly if you have chronic conditions such as diabetes, heart disease, or prostate issues. They can provide personalized guidance tailored to your health status. Part 7. Real-life success stories. Many men have experienced remarkable transformations simply by reintroducing masturbation into their lives after years of abstinence or sexual inactivity. George, a 70-year-old retiree, shared that after stopping masturbation due to fear of prostate cancer, he noticed declining erections and persistent fatigue. Encouraged by his urologist, George gradually resumed masturbation and found his energy improved, his erections became stronger, and he felt more emotionally balanced. Frank, age 65, struggled with depression and low self-esteem after losing his wife. He avoided all forms of sexual activity, which further isolated him. Through therapy, Frank learned that masturbation was a form of self-care and self-connection. This shift helped restore his confidence and improved his mood. Michael, 68, living with type 2 diabetes, had avoided sexual activity, fearing complications. After medical consultation, he incorporated gentle masturbation into his routine. Over time, Michael's blood sugar control improved partly due to better stress management, and his sexual function saw a positive change. These stories reflect how masturbation is not just a physical act, but a holistic practice that benefits mental health, emotional resilience, and physical well-being. Men who embrace this natural part of themselves report greater happiness, improved relationships, and a renewed sense of vitality. Part 8. Final words and call to action. Sexual health is a vital component of overall well-being, especially as we age. Masturbation remains a safe, natural, and effective way to maintain sexual function, boost hormone levels, improve mental health, and support prostate and cardiovascular health. If you stop masturbating or are hesitant to engage in sexual activity, know that it's never too late to start again. Listen to your body, seek professional guidance when needed, and treat yourself with kindness and patience. Remember, maintaining sexual health is part of living a full, vibrant life, one where age does not define your desire, pleasure, or self-worth. If you found this video helpful, please like, share, and subscribe to our channel for more expert advice on men's health and wellness. Comment below with your questions or experiences. We're here to support you on your journey. And don't forget to consult your healthcare provider for personalized advice tailored to your unique needs. Thank you for watching, and here's to your health and happiness at every age.